Hi, good morning. My name is Luther Mangoba. I'm a family medicine physician, and my private practice is Luther Mangoba, MD Inc. The service, compared to the other affiliations I've had, is excellent. Our rep responsible for our office, Melissa Alexander, has been very responsive to all of our questions and concerns, and she has resolved all of the issues we brought to her to our satisfaction. Highly personable service and very excellent customer service. We have access to the electronic internet portal for our reports as well as referrals for specialists, and so my staff use that extensively to send out our referrals, check on the status of referrals. E-consults, and that's been something that we've been using now for I think 2 or 3 years, and it's been very helpful in terms of facilitating a quick turnaround to the clinical questions that we have regarding patient care. We are also with a malpractice company called Capian PT, and Inland Valley IPA has been able to secure a discount for their physician members. For some of the, say, orthopedic cases, we've been able to send either imaging reports or copies of images directly for recommendations whether to send the patients in immediately for management or if additional workup was needed. So with that regard, orthopedic consultation is possible through their e-consult network. And then the other specialists, cardiology, you can send copies of the EKGs done in your office as well as other cardiac studies, and the cardiologist on the other end will give some recommendations for either further testing or approve an immediate visit with a cardiologist in the network. With regards to the e-consult, those we usually get within, I want to say, no more than 2 working days have we had to wait for a clinical response to our clinical queries. So it helps reduce the wait time for some of the patients to get an answer, or it reduces the wait to actually get a consult authorized for the in-person visit. I'd say for me specifically on the business end, it's just nice to have access to the reports in terms of our patient enrollment, the breakdown of the different payers that we have our patients with. I think the referral submission is also very helpful because we have a record of when we submitted the request. So if there's any delay in authorization, we can track delay occurred, and patients just know that we've sent it. We can show proof that we've sent something. And I've recommended the group to several physicians already, and I want to say there's been at least 3 or 4 that I've recommended that have signed up. Excellent with regards to the rep that comes to see our office. Access to the specialty network is very easy, and the network itself is filled with specialists that we already use for our fee-for-service patients. Lastly, their rates are actually better than the competition, so that's one big reason why most of them are probably signed up, because they have better capitation rates compared to 2 other IPAs I'm not going to name.